When your knees feel stiff in the morning, the first few steps can feel strangely difficult. You sit up, place your feet on the floor, and before the day even begins, your body seems to say, "Not so fast." Maybe your knees feel tight. Maybe they feel heavy. Maybe they bend, but not smoothly. Then after a few minutes of walking around, they slowly begin to loosen. After 60, that experience is common. But common does not mean meaningless. Morning knee stiffness is not always a sign of something serious. It does not mean your knees are ruined. It does not mean you are headed for surgery. But it can be a signal worth understanding, because the way your knees feel after rest can tell you something about your joints, your muscles, and how your body is changing with age. Many people explain it away with one sentence: "I'm just getting old." But that answer is too simple. Age can make knee stiffness more likely, but age itself is not a diagnosis. One person in their 70s may walk easily every morning. Another may struggle to stand from a chair. The difference may involve arthritis, past injuries, muscle strength, inflammation, body weight, activity level, or other health conditions. So instead of asking, "Am I just old?" a better question is, "What pattern is my body showing me?" One of the most common reasons for morning knee stiffness after 60 is osteoarthritis. Osteoarthritis often affects weight-bearing joints like the knees. It happens when the tissues inside and around the joint change over time. Cartilage, which helps cushion the ends of bones, may become thinner. The joint may not glide as smoothly. The surrounding tissues may become irritated or tight. That is why the first movements of the morning can feel harder. During the night, your knees may stay in one position for hours. They are not moving. The joint is quiet. The muscles around it are relaxed. Then suddenly, you ask those knees to carry your body weight. Bend, straighten, and walk. For a younger joint, that transition may feel automatic. But for a joint with arthritis, stiffness, swelling, or weaker muscle support, the first few minutes can feel slow and uncomfortable. This is why some people notice that their knees feel worse right after getting out of bed, or after sitting through a long meal, a movie, or a car ride. The stiffness may ease once they begin moving. The joint warms up, circulation increases, the muscles start helping again. That pattern can be common with osteoarthritis or inactivity, but it is still a pattern worth noticing. The mistake many people make is thinking that stiff knees should be protected by avoiding movement altogether. They think, if walking hurts, I should walk less. If stairs bother me, I should avoid stairs. If my knees are stiff, I should rest more. Rest has its place, especially when pain is severe or after an injury. But long-term avoidance can sometimes make the problem worse. Joints are meant to move. Muscles are meant to support them. When movement becomes too limited, the muscles around the knee can weaken, balance can decline, and everyday activities may become harder. This does not mean forcing yourself through sharp pain. It does not mean pushing beyond your limits. It means that gentle, appropriate movement is often part of protecting mobility, not the enemy of it. Another reason morning movement may feel harder is muscle support. Your knees do not work alone. They depend on the muscles in your thighs, hips, calves, and feet. These muscles help absorb force, control balance, and keep the knee moving in a stable way. After 60, many people gradually lose strength, especially if they have become less active because of pain, illness, fear of falling, or a more sedentary routine. When those supporting muscles are weaker, the knee may feel more strained during standing, walking, or climbing stairs. That weakness may not feel dramatic. It may simply show up as hesitation when standing, stiffness on the first steps, or the feeling that your knees need time before they trust a movement. Inflammation can also play a role. Inflammation does not always mean something dangerous. Sometimes it is part of joint irritation. If the knee is irritated, even mildly, the tissues around the joint may feel swollen or tight. That can make bending or straightening the knee more difficult. Some people describe this as pressure. Others describe it as a tight band around the knee. Others simply say, "My knee doesn't want to move." Past injuries can matter too. A knee injury from decades ago may become more noticeable later in life. An old sports injury, a fall, a meniscus problem, or years of physically demanding work can change how the joint behaves over time. You may not think about that injury anymore, but the knee may still carry the history. Body weight can also affect the knees, especially because the knees carry weight during walking, standing, and stairs. For people with knee osteoarthritis and excess body weight, reducing stress on the joint may be part of a broader medical plan. But this should always be approached respectfully and personally, because knee pain can also make movement harder. It is not about blame. It is about understanding load, strength, and mobility. Now, there is another important point. Not all morning stiffness is the same. If your knees feel stiff for a few minutes and then gradually loosen as you move, that may fit a common pattern seen with osteoarthritis or inactivity. But if stiffness lasts a long time, especially more than 30 to 60 minutes, or if it comes with swelling, warmth, redness, fatigue, fever, or symptoms in several joints, it is worth asking your doctor about. Sometimes inflammatory arthritis or another medical condition can cause longer-lasting morning stiffness. That does not mean you should assume the worst. It simply means the pattern is different, and different patterns deserve attention. You should also pay attention if your knee suddenly becomes very swollen, red, hot, or severely painful. If you cannot put weight on it, if it locks, buckles, looks deformed, or if you have calf swelling, numbness, tingling, or bluish color below the knee, that should be checked promptly. Those signs do not belong in the same category as ordinary morning stiffness. For everyday stiffness, one of the most useful things you can do is observe the details. How long does it last? Does it improve once you move? Is it one knee or both? Does it happen only in the morning, or also after sitting? Is there swelling? Does the knee feel warm? Does it ever give out? Does it stop you from walking, using stairs, shopping, or leaving the house? These details may seem small, but they can help a healthcare professional understand what may be happening, and they also help you avoid two extremes, ignoring everything or fearing everything. The goal is not to panic about every stiff morning. The goal is to become more aware of your own pattern. Safe habits can also support knee function. Gentle daily movement is often helpful for maintaining mobility. This might include walking, light stretching, water exercise, cycling, or other low-impact activities that feel appropriate for your body. The goal is not to punish the joint. The goal is to keep the body moving consistently and safely. Changing position during the day may also matter. If you sit for long periods, your knees may feel stiff when you stand. Breaking up long sitting time with gentle movement may help some people feel less locked up. Strength and balance also matter, especially after 60. The stronger and steadier the muscles around the knee are, the better they can support daily movement. But if you have significant pain, instability, medical conditions, or a history of falls, it is wise to ask a doctor or a physical therapist what kind of movement is safe for you. Medication and supplements require caution. Many older adults reach for pain relievers or joint supplements when stiffness becomes annoying. But over-the-counter medicines can have side effects, especially for people taking blood thinners, blood pressure medication, diabetes medication, kidney-related medication, or other prescriptions. Supplements can also interact with medications, and some products make promises that go far beyond the evidence. Never stop or change medication because of a video. And before starting a new supplement or taking pain relievers regularly, talk with a qualified healthcare provider or pharmacist. The most important lesson is this: stiff knees after 60 are common, but they are not something to dismiss with one word: aging. Your knees may be telling you they need more consistent movement. They may be showing signs of osteoarthritis. They may be reacting to inactivity, inflammation, weakness, old injury, or another condition that deserves attention. The clue is in the pattern. Stiffness that eases after a few minutes is different from stiffness that lasts for an hour. Mild tightness is different from swelling, warmth, redness, locking, buckling, or severe pain. A familiar pattern is different from a sudden change. Your knees are not just joints. They are part of your independence. They help you stand from a chair, walk to the mailbox, climb steps, shop for groceries, visit family, and move through your life with confidence. So if your mornings have started with stiff knees, do not immediately assume the worst. But do not ignore the message either. Notice it, track it, move wisely, and if it is new, worsening, severe, or limiting your life, Ask a healthcare professional about it. After 60, the goal is not perfect knees. The goal is to understand your body well enough to keep moving safely, steadily, and with confidence. And if you want more calm, clear explanations about health after 60, subscribe and keep learning what your body may be trying to tell you.